Hi everyone, this is Jamie Larson. I am here with one of our pediatric providers, Terry Townsend. And we just wanted to open up and talk about the recent formula recall that has been going on the last couple days. So Terry, can you talk to us a little bit more about that?
So Similac had multiple of their types of formula recalled due to potential contamination with some bacteria. They've not found any in the actual cans yet, but just out of precaution and because it's babies, we want to be extra cautious. So right now it's very difficult to find those Similac brands, but make sure you check your lot numbers and those things. There's information at similacrecall.com. And then some symptoms looking for would be like severe diarrhea, like if they're having blood in their stools, if they're vomiting really frequently, if you're not having wet diapers, anytime they're not having wet diapers, we definitely want you to be calling. Or if they're decreasing, or if your baby's just really not themselves and kind of either extremely fussy or maybe they're lethargic or just not as active, give us a call. There are a lot of GI viruses, so lots of stomach bugs going around, which can look like some of the symptoms of maybe a formula problem. So either way, if you're concerned, I always say call your healthcare provider and see what things you need to investigate.
Perfect. So what should parents buy if their formula has been recalled?
So you can do a different brand. There's multiple brands out there. So if they have it in the store, if it's a different brand and it says it's like equivalent to say your Similac Advanced or Sensitive or whatever, if it's equivalent to what your kid has been having. Also the store brands are also fine for you to use. So whether it's Parents' Choice, that's, Walmart, Target, CVS, whatever those things may be. You can use any of those, just you want to look at what the equivalent is so that you're getting the similar type that you had before.
Awesome, good to know.
Some of the things we definitely want you to avoid, so babies less than 6 months, even if you're worried about hydration or those things, we don't want you giving them extra water. The water they get when you mix with the formula is fine, you don't need to do additional. And then also cow's milk, if they're not one, we want you to avoid cow's milk. So if you can't find formula or those things, definitely reach out to your healthcare provider, but don't resort to the cow's milk just because their body's not quite ready to tolerate that yet.
Thank you so much, Terry, for answering our questions, and those were all really good points to keep in mind. If you have any questions, there will be a link below that will link you to the Iowa Department of Public Health, and they should be able to answer all of your questions.